Do you have pain on the bottom of your heel right here? It might be a heel spur. And this is Tom Bernacki. You've been here before with heel pain and you've tried some of the previous advice, but I'm gonna show you some new tips and tricks that are completely different. And the philosophy is different because we're not focusing on expensive or painful or long time off your feet solutions. We're working on stuff that works right now. Guys, thank you so much for watching. Give us a like, give us a subscribe, and we're gonna keep bringing you the absolute best foot care videos on YouTube. So a heel spur happens at the bottom right here. It's a 2 millimeter or more spur. We sometimes see them be up to ½ an inch in size. They get so big that they could actually break off. And technically this is bone that is not supposed to be there. It is said that heel spurs can happen up to 15% of the population, and they can cause pain. Studies do show that they can cause pain. Risk factors for a heel spur are the older you are, the more likely you are to be in that 15% of people who have a heel spur. The more overweight you are, the more likely you are to have a heel spur. The more you have foot problems like plantar fasciitis or Achilles tendonitis, the more you are likely to have a bottom of the heel spur or a back of the heel spur. The more you have arthritis in other areas like knee, hip, back problems, the more likely you are to have a heel spur. The more you have muscle imbalances, so this means diseases like one broken leg versus another broken leg, you're more likely to have a heel spur. Guys, there's so much studies on heel spurs now where we know what works and what works quickly. Here's what a heel spur is. It actually is new bone creation right here on the bottom of your heel right here. What happens is there's a ligament called your plantar fascia. So you could see right here that connects your heel to your toes. And what happens is as this gets stretched, when your foot flattens out, when that flattens out, look, it stretches the bottom right here. This is my demo prop of my plantar fascia. You can see it's pulling out of my heel. When I pull it up, it would stretch and pull on the heel. That would pull on the bone and create pain. So you can see here, my left foot is where I have the plantar fascial pain. My right foot has more flexibility. The left foot can't band up as much. That's a 10-degree difference. So my foot instead turns out more and pulls on the plantar fascia more. So look at the right foot can bend past 90 degrees, whereas the left foot barely makes it. There's a 10-degree difference. Every night that rips that plantar fascia out of the heel. So it rips out of this area, and every night, as it rips out of that bone, your heel tries to form new bone to strengthen it. And as the years go by, 10, 20 years of built up heel pain, you start to develop extra bone. So the problem is if I did surgery to remove that heel spur, where's that plantar fascia going to attach? That's the problem. That bone is actually there to strengthen your plantar fascia. It's kind of like a tent peg that's ripping out of the ground and the ground rises up with it. That's a great way to think about it. So if I got rid of that ground, that tent peg's not actually anchored into anything. What happens is as you start to develop being overweight, proper balance on that foot, you're stiff, you're older, you've got less muscles, you're less flexible. If you don't correct those things, then the spur's gonna get bigger. Where a spur does cause pain, and this is why a spur does cause you pain, is number one, the spur could get so big it could break. Number two, there's not enough fat pad covering that heel spur. Number three, you're already heavier and more imbalanced and less mobile. So I'm gonna count that as 4 as well. So you're already putting a lot of pressure there. You're more likely to have a Baxter's nerve impingement. You're more likely to have plantar fasciitis. But the first thing you wanna do is you wanna see your podiatrist because we can evaluate you, get an x-ray, get an ultrasound. This is stuff we could do in like 2 minutes in the office sometimes because people sometimes have been treating the absolute wrong thing. A heel spur is sometimes a nerve injury. It's sometimes back pain. It's sometimes a longer leg than the other. It's sometimes just switching the shoe. It's sometimes something so easy that you never would have thought of, but that's what your podiatrist or your doctor can do for you. So if you're struggling with this for years, get checked out, get an x-ray. Sometimes it's something simple. So studies have actually shown that lengthening the calf muscle like this, if the foot can bend up more, there's less pressure on the plantar fascia down here if the calf is more flexible. So what we want to focus on is you want to focus on massaging the plantar fascia and the heel spur, icing it, cooling it down, and stretching out the calf muscle. So you can see right here, I've got some fancy devices. If you can grab a can or a water bottle, freeze that, get some water on it, and just roll your plantar fascia and the front of the foot across there. So see that? That's actually working really nice. That's chilling the whole area. That's doing really good. This one, you actually have to hold it to do something like that, but that feels really good. See, this one, you can't really hold it because it moves around. So that's a thumbs down on that one. But this works really good for other joints and muscles, like your calf. These ones, on the other hand, you have a little one like this. That actually works really good. I really like that one. That's A+. So that's working really good. I like that quite a bit. The bigger, softer one, less spikes, that works really well. So that works great as well. After doing all that, we're ready to do our stretching. So if you can't reach your toes, so I can reach my toes and I can do some good stretching. So check that out right there. I can get a good stretch just like that. But if you can't reach, roll up a towel like that. Ooh. See, that's the downside of the towel, but grab your foot and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then you do the other one. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm also a big fan of BioFreeze right here. This is actually a roller like this, where you could just roll it onto the bottom of your foot like this. This is kind of like icy hot. It works just as good as ice without having to grab the ice. And these are pretty cheap. They're not too expensive. That's the real trick. This is gonna change your treatment. You have to stretch out your hamstrings, your calf muscles, so you do pain control on your plantar fascia, and you stretch out the calf muscle, the hamstring, and I'm gonna show you how to do that. But first, here's what you wanna do is, take a look at a shoe like this. When I walk, look at that. When that bends, that stretches the plantar fascia. So you could see when the foot bends like this, the plantar fascia stretches across the bottom and that rips out of the heel, causing a spur to form. So what happens is, not that you wanna go with a huge shoe like this, but look at, as you walk there, it rolls. That's called a rocker bottom effect. Or you can get a shoe that's more in the middle. You don't have to go too crazy, but sometimes good dress shoes, good walking shoes that you can then get an insert into. And here's why you want to use an insert. Look at this. The plantar fascia, when you land on it, it stretches, but watch this. No stretch. So look at, there's no stretch. Whereas right here, look at the stretch. Right here, it forces your arch to stay in place and the heel does not get stretched. You won't feel these results right away, but as a week or two go by, your heel will feel 10 times better. It happens virtually 99% of the time. And the people that aren't getting better, it's usually a different reason. Either it's not diagnosed properly or they're not actually getting the support they think they're getting. Here's a couple tricks as well. Take a look at here. This is my old worn pool sandal, but it has an arch in it. Take a look right here. For the people that want a good supportive sandal, it's possible. You can wear sandals. Look at, nothing's flattening out. Whereas right here, look at, it flattens out. Same thing with slippers. You can get a slipper with an arch built into it. you can get a slipper with an arch built into it. So my slippers, my sandals, everything has an arch built into it. Even a good supportive shoe if you're having a lot of pain. You don't have to go quite this big, but if you're having a ton of pain, it's worth it. Massaging works really good. Massage can break up the scar tissue, the thickness. So that works really good. And I actually like to do something called shockwave therapy. Shockwave therapy is basically like a vibration device where it pistons into the tissue and it can soften up that scarred, hard tissue where the bone and the scar tissue connect into each other. Sometimes 1 or 2 treatments really soften up that area. That can be very beneficial for people. The downside with shockwave therapy is it's pretty new. Insurance doesn't cover it very well, and it can be a little bit on the pricey side. So there's still better stuff coming.
The key to breaking up that thick scar tissue is to get a foam roller. And number one, you could break up the tightness in your hips, in your hamstrings. Don't worry, I'm going somewhere with this in regards to the heel spur. But loosen up those hips, those hamstrings, especially me. I have a tight left hamstring. I always massage it out every morning. Otherwise, I feel it more in my foot. So a foam roller is great for getting you flexible the rest of the day. Then the massage roller, your leg, your calf muscles. This will make your foot more flexible. So as your calf, your hamstring, and your glutes are more flexible, this lets you put less pressure onto the heel and the plantar fascia the rest of the day. So get into a great routine. Warm up in the morning, then you massage your feet at the end. That's your plantar fascia. And one of these spike balls, it will break up the scar tissue and the tightness in your heel. And over time, your heel spur will have less stress on it, even if it doesn't disappear completely.
One thing I'd love to do is, and sometimes it's this simple, but if the foot turns out like this, sometimes we can cast it and stretch it up like this. So with the foot turned in, I can stretch out the calf and put a cast on there at once. And what happens is that stays on for a week. That calf muscle can then get stretched out and that plantar fascia has almost no pressure on it in just a week or two sometimes. This goes with the surgical principles.
So a great thing to do is to make sure which foot is tight, which foot is loose. And to work on that flexibility, you have to get them symmetrical. Otherwise, that tighter foot will always have more problems. So you can see right here, my right foot's more flexible than my left foot. So I have to get my left foot more flexible over time. That's the goal of stretching and massaging that painful heel. So in this case, I want to wake up. This is after I massage roll, which you can see earlier in the video. When I wake up in the morning, I just want to rotate my ankles. I want to loosen them up every morning. I want to massage them with my hand, and I want to foam roll and massage roll. After I do that, look at how much more flexible I am. I could not do that before doing that stuff. And then you stretch. Don't stretch without massage rolling and foam rolling ahead of time in the morning if you're very stiff. Then you stretch. And we're talking just 30 seconds per muscle. That can work really well. That's really effective. And before that, you can see right there, the plantar fascia is tender when you get up in the morning. That foam rolling, that massage rolling, and then that stretching will make that immediately less painful. There's less stress on the heels. So then you want to ball up a towel. So this makes you actually stretch your plantar fascia and the Achilles tendon, and it makes it soft on the front of your foot. And it holds your feet from buckling out by having this towel. I love having that towel. You can do this on the stairs, but to save time, I just do both feet at the same time. And then you want to stretch the inside of your thigh, your groin, because sometimes your leg's turning in or out because of a tight hip, a tight thigh, a tight glute. You want to stretch those out for sure. I love an ankle strain board, and these are down in the show notes. These can work really well. I think it's painful to do these barefoot because the ball of your foot can get really sore because you're plopping all your body weight into it. So I'm going to show you a better technique in a second, but the point of this is you can measure your progress and it keeps both feet symmetrical. So when you start with a device like this, you can start at 15 degrees and work your way up to 50 degrees. That will really help that heel spur over time. So you can see right here it has different levels, 5 degrees to 50 degrees, and that really helps your hamstring and your plantar fascia over time. But what you want to keep in mind is massage ahead of time and warm up ahead of time. A great shoe and a great insert. Look at this, does half the battle. It stretches you while you walk, kind of how we mentioned earlier in the video, and it will keep your heel from being in pain when you stretch. These devices force all the pressure onto your calf, your Achilles tendon, and your hamstring, because studies show these are the muscles that are more important than just hammering away at that heel spur. So if you want to get rid of that heel spur, you have to get your body weight down. Unfortunately, I know it's not a magic bullet. And then stretch. I stretch every morning by warming up, then by putting on my shoes, my inserts, and then I use these stretching devices. Specifically, the ankle slant board is my favorite. I love using that in the morning. And you can measure it. Every month, you gain about 5 degrees, 10 degrees. These other devices are okay. I would go with the ankle slant board if you want to.
Guys, thank you so much for watching. Give us a like, give us a subscribe, and we're going to keep bringing you the absolute best foot care videos on YouTube.